Hi there, my name is Carissa Elk, and for this discussion, will be talking about the ACA Code of Ethics assessment procedures located in Section E of the ACA Code of Ethics. When I was reading through the Code of Ethics, I found it to be pretty thorough. I didn't really see anything that I thought needed to be added, which was good, but I did see some of the rules listed there that I thought were interesting and a little bit surprising. So the first one is Section E2B, which is entitled Appropriate Use. And that one, the summary of that one would be counselors are responsible for scoring and interpretation of the assessment, even if they don't personally score it or interpret it. And I just thought that was a good incentive to make sure that things are done accurately, even if the counselor uses a third party or is working with someone else in their firm. I think that that's just a wise rule. The second one I thought that was really interesting was Section E5D, which is refraining from diagnosis. And it's essentially counselors don't have to diagnose a client if the possible diagnosis is going to bring harm to the client or others involved with the client. So conceptually, that makes sense to me, and I think that is important to know. However, I just don't know logistically if you're at that point, which would bring more harm to the client to not diagnose them, or to have walked all the way through the assessment process and discussed, the procedures, taking the assessment and everything that's involved in that, and then to not withhold, but to not diagnose. I don't know. That might be even a little bit more confusing, and so I don't know if that would also cause harm to the client to not diagnose them. So I guess in my mind, maybe it would make more sense to me to just establish whether or not the client can handle the assessment and any possible diagnosis that would happen as a result of that would maybe be where I would go instead of that. But I think it is an important rule if maybe you think that the client is and you walk through that process and then you find out maybe the client isn't. But and then the third one that I thought was really interesting was in Section E13A, primary obligations. And this is specifically talking about for legal proceedings. And it's essentially saying that the primary obligation in legal proceedings is accuracy of the test and professional judgment, which I just found was really interesting because in this case, it wasn't the individual being assessed, not the client, because in this case, for legal proceedings, the counselor, it's not, I guess the individual they're assessing isn't the client. But I just thought that was interesting because in the introduction, it talked about that assessments are for client care and making sure that that the client is being taken care of. And so I just thought it was really interesting that the notable difference in when it's your client versus when you're doing something for legal proceedings that you're not necessarily primarily there to make sure that the individual being assessed is the utmost important. But those are the things that I noticed. Thank you for watching.